To this now, Health Minister Dr. Aaron Motsoaledi says he will act in due course on recommendations contained in a report on medical aid schemes, the Section 59 investigation panel into allegations of racial discrimination by medical aid schemes against black healthcare providers concluded that the right of procedural fairness of some individuals, practitioners, was violated. Dr. Motsoaledi has confirmed that Discovery, GEMS and Medscheme are among the medical aid schemes implicated in the report. Dr. Donald Gumede, chairperson at the National Healthcare Professionals Association, joins us now. Good afternoon to you, Dr. Gumede, and thank you so much for your time. So the Section 59 panel report, has made some serious findings and has essentially now confirmed what many black healthcare providers have long alleged, essentially around discrimination and unfairness when it pertains to the fraud detection and these claims processes of some of the major medical schemes. What is your overall reaction to the reports?
We feel vindicated as black professionals, because when we brought these allegations, we were called all sorts of names: lunatics, hallucinating people or professionals. And I remember one time when we were at the Human Rights Commission, one of the representatives of Discovery actually went to the length to say, "I'm lying." Yes, he literally said, "Dr. Gumede is lying. There's no racial profiling." And now it's said that actually racism, it's actually still rears its head in our country 30 years thereafter. But it's not surprising, because these guys, like in the final report is stated, it's because they believe they hold the power, so they can abuse and bully anybody who actually they choose to do so. And it's a sad part in our country, to say the least, because if the reverse was true, I don't know where us as professionals, where we're going to migrate to, because other races, they can migrate somewhere. Ourselves, we don't know where we're going to migrate to, because it's the only country that we know. So it's a very sad situation indeed.
Absolutely. So the medical industry, is pushing back. Discovery Health, for one, has strongly disputed the report, calling it unscientific. The panel has reaffirmed that it relied on subject matter experts and its conclusions based on sound risk ratio analysis. What's your response to the pushback? Particularly, what does it mean, in terms of accountability?
But, I was actually commenting in one of our groups of healthcare professionals, because you see, even the methodology that they use to extort, and I'm emphasizing the word extort the monies from the healthcare professional is wrong. Because you see, they cannot be the police officers. They become now the prosecutors, they become the judges, they become the prison wardens. It can't be right. Let's just look at that alone, let alone the racial part of it. The methodology that they're using is wrong. So, to say the least, obviously they will come out swinging, because it dents the egos and the image. And also, the shares might fall because of the findings. But, this was an independent panel, which actually was not influenced by us or anybody else. They tried. That's why the report actually was delayed, because the interim report, if you check, it was released some time ago. They've been submitting documents and information to the panel to try and sway them to find otherwise. But we do need a reform in the industry, unfortunately. Whether they scream and cry and whatever, but the CMS, the Council for Medical Scheme, must come out and then regulate these people.
And just staying with the reform part of it, I want us to take a step back in terms of just how widespread is the impact of these unfair practices on black and other previously disadvantaged healthcare professionals. And I'm talking here across the board, and perhaps give us a sense of the reputational and financial toll it took.
Oh, actually, it's so funny because this morning as well, I received few calls or many calls from our professionals who actually left private practice because of these medical aid bullies. Many of them, they've lost their income. Some of them had to take alternative careers because their practices were closed down. Others, like I mentioned before, they committed suicide. Some of them who were not strong enough because they had lost their income, they've lost their livelihood because of these people, because they didn't care. If you look at it closely, they will call you and tell you that if you don't pay us, we'll stop paying you. So it's either you succumb to their demands or you go hungry. And that's the painful part of it. You don't have any leverage to say, maybe let's have a neutral person who can adjudicate on this matter. They take the decision, whatever they deem is right. And I mean, it's a suck thumb phenomenon, what they do. You can ask anybody who has been called to their offices. They call you and tell you, we need 300,000. You said, I don't have it. They said, maybe, okay, let's go down to 250,000. To show that it's not scientifically proven. They just want money from you. And that money, as I stated also on the submissions, it doesn't go back to the patients. If I rob the patient as they claim, they must recoup that money and pump it back to the patient. But no, it goes to their forensic investigators and the medical aids and the administrators.
Dr. Gumede, you spoke about reform. I mean, the report itself, it recommends changes to the Medical Schemes Act, procedural fairness and clawbacks, and a greater transparency, etc. I mean, do you think this is enough in terms of just some of the changes that are needed? And also, I mean, it does also speak to where we are currently as a country, where a lot of these transformation kind of policies are currently being pushed back.
Yeah, correct. You see, I said to someone as well that we are good at everything written in this country. But the implementation is the problem in our country, to be honest with you. Because, like you saying, the tribunal that is suggested in the report, it's a perfect way of dealing with disputes. You must have people who are independent from the processes. You can't have two teams, maybe they're playing in the field. One team has got more power to make decision and straight decision. No, there has to be an independent person who actually adjudicate and award fouls and all that. And we welcome the recommendation by the panel to start the tribunal system, where we'll have a retired judge who sits there with his assistants to actually adjudicate on these cases, rather than the medical aid themselves adjudicating and doing everything by themselves. And if you don't succumb to that, then they stop making payments to you. Remember, if you run a practice, you have to pay rent. You have to buy medication if you are dispensing. You have to pay your staff. You have to do all those things. Now, if someone interrupts that, even if it's for a month or two, there are not many healthcare professionals who can survive. So these guys, they knew. And what they will do is they will target your bulk of your claims. So they will check if you have got more patients from Discover will come and visit you. Mm-hmm. If you have got more patients from Medscheme will come and visit you and extort the money. Mm-hmm. So it was an extortion game that they were playing. Yeah. We said this all along, and we were never believed. And now it has been proven. Now they're crying foul. But let's leave. They can dispute the racial connotations and whatnot. We don't care. It's happening. Yeah. We know, and they must just accede to the recommendation of the tribunal system.
And of course, Health Minister Dr. Aaron Motsoaledi, he's saying that he will act in due course on the recommendations contained in this report. What are you expecting to hear from him in the coming days?
I was with him yesterday, yes, on the handover of the report. You see, and he himself said it, that immediately starts with the implementation. That's when the medical aids will jump into courts. and try and block these issues because they have the capital or the monies to do so. Because they are not in the best interest of anybody, these guys. They are actually doing everything in the best interest of their pockets. Because if you check, that is just a tip of an iceberg, to be honest with you, because majority of the money doesn't go back to the patient, the one that you guys pay to the medical aids. It goes to the administrators. So he needs to sort out also that issue. The regulatory framework has to be tightened from the Council of Medical Scheme for it to be effective, because they are actually the custodian of that process, the Council for Medical Scheme. So our minister, he can only recommend and to the Council for Medical Scheme to go on and make sure that actually they implement the whole processes of the Section 59 recommendations.
Dr. Gumede, thank you so much for your time. Really do appreciate it. Dr. Donald Gumede, chairperson at the National Healthcare Professionals Association, speaking there and responding, of course, to that Section 59 investigation panel report.